All right, so we all have our own bathroom habits, but are your bathroom habits good or bad? Keep watching to learn some of the best and worst bathroom habits you can have and my best bathroom tips for you. I'm Dr. Alex Hill. I'm a board-certified pelvic health physical therapist. Make sure you subscribe to my channel below for more videos on how to get the best pelvic health. Okay, so first let's go over some of those bad bathroom habits that a lot of people do, and then we'll go through some of the better ones to do. Keep track of what habits you're doing and what you can do to fix them to have better bathroom trips. All right, first up is power peeing. If you're in a rush to finish peeing and you push to get that urine out just to get done faster, you're a power peer. But long term, power peeing is not good for your bladder. Over time, it can disrupt the coordinated relaxation of the sphincter at the urethra and the contraction of the bladder, which could ultimately lead to decreased bladder strength and sensation, as well as even more difficulty emptying your urine. Instead of pushing and rushing to empty your bladder, give yourself some time to fully relax your bladder and the pelvic floor muscles. Next up is hovering to pee. So these are your pelvic floor muscles. They sit at the bottom of your pelvis and they have a lot of functions. One of them is helping to keep you stable. When you hover over the toilet to go pee and you're in that squatted position, your pelvic floor muscles activate and contract. Since they're contracted, this can make it harder for your bladder to empty fully, and you may have to then push harder to get that urine out. If you normally sit at home to pee, then pee when you're out in public toilets. If you don't feel comfortable sitting directly on the toilet seat, then use those toilet seat protectors or just use a couple layers of toilet paper on the seat and sit on that. Sitting fully on the toilet allows your pelvic floor to relax completely and to empty better without having to push. The third bad habit is always going pee just in case. You might be guilty of just in case peeing if you're going to the bathroom always right before you leave the house, right before that gym class, or right when you get to the grocery store, for example. Even if you don't really need to go, you're going just in case. If you're doing this pattern, you're basically training your bladder to have the urge to pee at those times, which over time can increase urgency and frequency and maybe even leakage in these situations. It can also train your bladder that it thinks it needs to pee, even if it's not completely full, which again can cause more urgency and more frequent trips to the bathroom. Going just in case all the time just trains your bladder into bad habits. Now, once in a while in specific situations is fine. So, for example, you're going on a long road trip or you're sitting through a long meeting or a long movie, but just don't make it into a constant habit that you're doing all the time. And finally, one of the other bad habits that a lot of people do is straining to start peeing or pooping, because over time, this can weaken the pelvic floor muscles. It causes excessive strain on the pelvic organ and nerves. It can even cause hemorrhoids, anal fissures, or even incontinence or leakage. You should avoid straining and instead address why you're having to strain in the first place. That means working with your medical provider and a pelvic health physical therapist to really get to the root cause of why you're needing to strain. You might be needing to strain because of an underlying medical issue, or it could just be that these pelvic floor muscles are not coordinated and they're actually contracting when you're trying to push to poop and pee instead of relaxing to evacuate. In this case, pelvic health physical therapy can help you retrain your pelvic floor muscles and stop straining. All right, so now let's talk about some of the best bathroom habits to have and some tips for you to take to the bathroom. So instead of rushing and power pushing to urinate, take your time. Sit and relax your mind and body, specifically those pelvic floor muscles. The more you relax, the easier it is for your bladder to contract to fully empty out. Next up is staying hydrated. If you're having bladder issues like urgency, having to make frequent trips to the bathroom, you might be tempted to cut back on your water intake, but that's actually not good for your bladder. Keeping up with drinking water throughout the day will help make sure that the bladder fills appropriately, helps to flush out bacteria and other waste in your urine. It decreases the risk of kidney stones, decreases bladder urgency and irritation, and helps your stool or poop soft to decrease constipation. Try to drink water evenly throughout the day instead of gulping down a bunch of water at one time, which can cause some urgency. Personally, I'll drink 32 ounces from the morning until lunch and then refill it for another 32 ounces from lunch until dinner. But if you're exercising, you're out in the heat, you're taking certain medications, then you likely need to have more water to stay hydrated. Really, you want to aim for your pee to be the color of light lemonade. If it's darker than that, you know you're not getting enough water. Next up is letting your bladder fill. It's normal to urinate about 4 to 6 times a day or every 2 to 4 hours. Your bladder, when it's completely full, which is about 16 ounces or a water bottle, when it's full, that means that it's able to effectively contract better to help you empty. If you find that you're going to the bathroom much more frequently than every 2 to 4 hours, first take a look at what you're drinking. If you're drinking a lot of bladder irritants like caffeinated, carbonated, acidic, sugary, or diet drinks, these are all things that could make you have to go way more often than you should and possibly increase your risk of leakage. So if you have urgency, you're frequently going to the bathroom, stick to the water and cut out those irritants. All right, last up is using a step stool to poop. If you've heard about the benefits of a squatty potty or using a step stool to poop, this is not a myth. Sitting in this position with your feet up on the step stool, your knees slightly above your hips and leaning forward is going to help with relaxing and opening up the rectum so the stool can come down easier. Bonus points for the squatty potty is you can push it up underneath the toilet so that you don't trip on it. If you don't have a squatty potty or you're out in public, even just leaning forward onto your thighs in a comfortable position can be helpful. Another tip, if you're traveling and you're in a hotel that has a small garbage can in the bathroom, go ahead, just flip that on its side and you can use that as your step stool. All right, so how are your bathroom habits? Are you helping or hurting your bladder and your bowel and your pelvic floor? Try working on just improving one thing at a time with some of these tips that I've given you in this video to improve your bladder health, bowel health, and overall pelvic health and bathroom trips. If you found this video helpful, go ahead and give it a like, share it with anyone who might benefit, and make sure to subscribe to my channel for more videos on pelvic health.